Everybody hi. Our bodies are governed by a complex network of biological clocks that coordinate daily physiological rhythm. The master circadian clock in the suprachiasmatic nucleus synchronizes sleep-wake cycles, hormone secretion, metabolism, and cardiovascular function to the 24 light-dark cycle. A key signal for these clocks is the hormone melatonin, which helps regulate the timing, duration, and subjective quality of sleep. Modern disruptors of ancient rhythms. In pre-industrial times, daily life adhered to natural light-dark patterns characterized by minimal nighttime light exposure and no rapid travel across time zones. However, modern lifestyles have introduced powerful disruptors to this rhythm, including artificial light at night, shift work, and extensive evening screen use. Exposure to bright or blue-enriched light late in the evening suppresses endogenous melatonin secretion and delays the biological night, effectively shifting the window for sleep onset. Consequences of circadian misalignment. When melatonin signaling is disrupted, biological clock begin to malfunction, manifesting as a wide spectrum of clinical complaints. Typical issues include difficulty initiating or maintaining sleep, non-restorative sleep, daytime fatigue, and mood disturbances such as irritability. Furthermore, altered nocturnal blood pressure dipping patterns may occur. Chronic circadian disruption is increasingly linked to metabolic dysfunction and elevated cardiovascular risk, underscoring the vital importance of protective, healthy sleep-wake rhythm. A chronobiotic, non-hypnotic. Endogenous melatonin is useful tool in specific context, but it should be viewed as a chronobiotic, a timing regulator, rather than a universal sedative. Evidence supports its issue for circadian rhythm sleep-wake disorders, such as delayed sleep-wake phase disorder, jet lag, and non-24-hour sleep-wake rhythm disorder, as well as for insomnia in older adults and children with neurodevelopmental conditions. In this setting, correctly timed dosing can reduce sleep onset latency and improve subjective sleep quality, though the magnitude of effect is often modest. Realistic expectations and individual variability. Melatonin is not appropriate for every patient with insomnia or fatigue, and expectation must remain realistic. Meta-analysis and umbrella reviews indicate only small average improvements in sleep parameters with considerable inter-individual variability. Some patients experience a clear benefit even at low doses, 0.5 to 1 mg, while others report to meaningful change, highlighting the significance of individual sensitivity to the hormone. The therapeutic trial approach. Clinically, a brief therapeutic trial is the most practical way to determine suitability. If a low dose taken at the appropriate clock time yield expected improvements in sleep timing or consolidation within several days, melatonin is likely addressing an underlying circadian misalignment and can be continued short-term. Conversely, if there is no discernible effect, continued supplementation is unlikely to provide benefit and may unnecessarily medicalize sleep problems, better managed through behavioral strategies. Safety profile and regulatory caps. Melatonin is generally well tolerated. Side effects such as daytime sleeping, headache, or dizziness are infrequent and typically resolve upon discontinuation. Short-term use at low to moderate doses appears safe in adults and specific pediatric populations when clinically guided. However, in many jurisdictions, melatonin supplements are not tightly regulated. Consequently, the actual hormonal content may vary significantly from the labeled dose, and safety data regarding high-dose long-term use remain limited. Emerging signals, long-term safety concerns. Emerging observational data suggest a need to caution regarding chronic use. A recent large database analysis of adults with insomnia found that melatonin use for a year or longer was associated with higher rates of heart failure and all-cause mortality compared to no users. While causality cannot be established from such observational studies, these findings highlight the need to juncture patient selection and further research into cardiovascular safety. The prescribing and exit strategies. Given these uncertainties, melatonin should generally be prescribed for a limited period as part of comprehensive sleep plan rather than as an identified treatment. Once a patient's sleep-wake schedule is stabilized, the supplement should be tapered and stopped to allow the endogenous melatonin system to resume its regular role. Recurrent insomnia warrants a reassessment of underlying causes and a focus on evidence-based therapies such as cognitive behavioral therapy for insomnia. The non-pharmacological foundation. Ultimately, the foundation of circadian health is behavioral, not pharmacologic. Key strategies include maintaining consistent bedtimes and wake times, aligning sleep with the natural light-dark cycle, and strictly limited blue-rich light exposure in the hours before bed. For many individuals, optimizing the sleep environment, keeping it dark, quiet, and cool, and increasing morning daylight exposure can significantly improve sleep quality without the need for supplements. And conclusion. Melatonin is a potent regulator of the biological clock and a valuable adjunct for specific disorders when used thoughtfully. Its primary role is to fine-tune sleep timing rather than replace healthy habits. Clinical use should be time-limited, individualized, and vigilant regarding emerging safety data. Protecting natural circadian rhythm through behavior and environment remains the central strategy for keeping the body's clock running on time. Thanks for likes and sharing.